Think about any complex skill, from flying a plane to writing code. They all have their own unique language, right? Well, the human body is absolutely no exception. To really get how it all works, first, you've got to learn to speak its language. So let me ask you this. If a doctor told you a patient had a scar above the wrist, where would you even picture that? Is it on the forearm? Maybe the back of the hand? The palm side? It's incredibly vague, and that ambiguity is exactly the problem we're talking about. And you can imagine, in medicine, that kind of vagueness isn't just confusing, it can be downright dangerous. This is where the language of anatomy saves the day. It's this universal, super precise terminology with roots in Greek and Latin that's designed to get rid of any and all ambiguity. It means a doctor in Tokyo and a doctor in Toronto can talk about the very same spot on the body with zero confusion. All right, so to start learning this language, we first need to understand the blueprint of what we're actually describing. Turns out, the body is organized into 6 distinct levels, and each one builds on the one before it. It all builds from the ground up, literally. We start at the chemical level, with atoms clumping together to form molecules. Then, those molecules build our cells, the tiniest units of life. From there, cells group up into tissues, which then form our organs, like the heart or the liver. Those organs then team up into organ systems. And finally, all of those systems together create a complete organism. You, me. It's this incredible ladder of complexity that our anatomical language is built to describe. And we're not talking about a simple structure here. We have 11, that's right, 11 distinct organ systems, from muscular to nervous to digestive, all working together. So describing them with perfect clarity is absolutely essential, which brings us to the foundational rule of this language. You know how every map needs a "you are here" marker, a fixed point of reference? Well, in anatomy, we have a universal starting point called the anatomical position. You can think of it as the body's official default setting, and every single description is made from this one position. Now, here's what's so critical to get. It doesn't matter if a person is lying down, sitting, or even doing a handstand. All anatomical descriptions always refer back to this one standard pose: body upright, feet parallel, arms at the side, palms facing forward. This is our universal ground zero, no matter what. Okay, so with our starting point locked in, we can finally learn the core vocabulary, the specific directions for the body. The absolute best way to think about these terms is like a built-in GPS, giving you precise turn-by-turn directions from one point to another. First up, let's talk about up and down. Superior just means above or closer to the head. So for example, your eye sockets, your orbits, are superior to your mouth. And the opposite is inferior, which means below. So your pelvis is inferior to your abdomen. Easy enough, right? Next, we've got front and back. Anterior refers to the front of the body, and posterior refers to the back. A great little trick to remember this is that dorsal, another word for posterior, is like the dorsal fin on a dolphin's back. So, for instance, your toes are anterior to the rest of your foot, while the back of your knee is posterior to your kneecap. Now, this next pair is used mostly for our limbs, our arms and legs. Proximal means closer to the trunk of the body, while distal means farther away. Just think proximal is in the proximity of your torso. So your upper arm is proximal to your wrist, and that makes the wrist distal. And our final core pair is all about layers. Superficial means closer to the surface of the body, while deep means farther away from it. A perfect example? Your skin is superficial to your bones, and your brain is deep to your skull. So we have our starting position, and we've got our GPS directions. The final piece of this whole puzzle is understanding the different ways we can view the body. To do this, anatomists and modern MRI machines slice the body along what they call imaginary planes. A plane is really just an imaginary flat surface that passes through the body, kind of like a sheet of glass. The 2D view that you get from that cut is called a section. And hey, if you've ever seen an MRI or a CT scan, you've seen these sections. They're those slices that let doctors see right inside you without ever making a single cut. Now, there are 3 main planes we use all the time. First is the sagittal plane, which cuts vertically and divides the body into left and right sides. Then you have the frontal plane, which also cuts vertically, but this time it divides the body into front and back portions. And finally, there's the transverse plane, which cuts horizontally, creating what we call a cross-section, separating the upper and lower parts of the body. And this right here is exactly why it's so critical. One of our sources just nails it with this quote. Scans can only be interpreted correctly if the person looking at them understands the plane on which the section was made. A view of the abdomen in the transverse plane looks totally different from a sagittal one. In modern medicine, this isn't just nice to know, it's non-negotiable. So, there you have it. Those are the fundamentals of a brand new language. We've gone over the default setting for every description. That's the anatomical position. We've learned the core vocabulary, the body's own GPS. And now we get the three main planes used to view the body from literally any angle. This language, it's the key that unlocks the mind-bogglingly complex map of the human body. It allows us to communicate, to investigate, and to heal with a kind of precision that was once totally unimaginable. So the real question becomes, now that we can speak the language, what secrets are we going to unlock next?